Nutrition, energy balance, and weight management. Nutrition, energy balance, and weight management. Question: the relationship between energy intake and energy expenditure. Answer: energy balance. The relationship between energy intake and energy expenditure. The answer is energy balance. Question: when the calories consumed match the amount of energy expended. When the calories consumed match the amount of energy expended. Answer: energy equilibrium. When the calories consumed match the amount of energy expended, the answer is energy equilibrium. Question: if energy intake exceed energy expended, the answer is positive energy. Balanced energy is stored, resulting in weight gain. If energy intake exceed energy expended, positive energy balance, energy is stored, resulting in weight gain. Next question: when is positive energy balance desired? Answer: pregnancy, infancy, childhood, and adolescent, and to restore body weight to healthy level after losses caused by starvation, disease, or injury. When is positive energy balance desired? Answer: pregnancy, infancy, childhood, and adolescent, and to restore body weight to healthy levels after loss caused by starvation, disease, or injury. Question: does aging cause weight gain? Aging cause weight gain? Answer: no. It stems from pattern of exceed food intake coupled with limited physical and slower metabolism. Question: result when energy intake is less than energy expenditure. Answer: negative energy balance accompanied by weight loss. Energy stored in body is used to make up for shortfall in energy intake. Result when energy intake is less than energy expenditure. Answer: negative energy balance accompanied by weight loss. Energy stored in body is used to make up for the shortfall in energy intake. Device that directly measure calorie content. Question: device that directly measure calorie content. Answer: a BAM calorimeter. Answer is a BAM calorimeter. Question: the three main purposes that the body use energy for. The three main purposes that the body use energy for. Answer: 1. Basal metabolism. Number 2. Physical activity. And number 3. Digestion, absorption, and processing of ingested nutrients. Selecting healthier food choice that are lower in salt, added sugar, saturated fat, and trans fat are good for the health. True. Answer is true. Selecting healthier food choice that are lower in salt, added sugar, saturated fat, and trans fat are good for the health. Answer is true. Question: positive energy balance means I consume more food than exercise. Answer is true. Positive energy balance means I consume more food than exercise. Answer is true. People whose dietary pattern include fresh, whole food like fruits and vegetables, whole grain, legumes, lean meat, and fish have a lower incidence of answer, major chronic diseases and diet-related disease. I can eat any food in moderation and stay healthy. Answer, false. Question, fill up your healthy plate with, answer is vegetable and fruits. My healthy plate is, the answer is designed by HPB especially for my healthy plate is friendly, easy to understand visual guide for creating balanced and healthy meal. It shows what to eat in the right amount of each meal so that you can play your portion accordingly. Question, which of the following is healthy meal? Which the following is healthy meal? The answer is 1 portion of brown rice, 1 portion of steamed fish, 1 portion of beans, and 1 portion of apple. Which the assessment tools of accuracy? Answer is DEXA or X-ray absorptiometry. Which the assessment tools of accuracy? The answer is DEXA or X-ray absorptiometry. Fat-free mass bone, lean mass water. Fat-free mass bone, lean mass water, 73% water, 20% protein, and 6% in minerals. Health consequence of excess body fat. Number 1 is psychiatric and psychosocial problem such as depression and low self-esteem. Number 2, respiratory problems such as sleep apnea and asthma. Number 3 is fatty liver. Next is gallbladder disease and gallstone. Next is elevated fasting blood glucose and type 2 diabetes. Next is gynecological problems including an abnormal menstrual cycle and infertility. Next is arthritis and gout. Next is cardiovascular disease, this including elevated blood, triglyceride, LDL, cholesterol low, HDL, cholesterol, atherosclerosis, hypertension, and stroke. And increased risk for cancer of breast, colon, uterus, esophagus, pancreas, kidney, thyroid, and gallbladder. Overweight. Overweight being too heavy for one height, usually due to an excess of body fat. Overweight being too heavy for one height, usually due to excess of body fat. BMI 25 minus 29.9 kilogram dash meter squared. BMI 25 negative 29.9 kilograms meter and squared. Obese. Obese is having excess body of fat. Obese, having excess body fat. BMI is 30 kilograms meter squared. BMI 30 kilograms meter squared. Appetite. Appetite is desire to consume specific food triggered by external cues. For example, smell. Independent of hunger. Appetite is independent of hunger. Hunger. Desire to consume food that is triggered by internal psychological signal. Hunger. Desire to consume food that is triggered by internal psychological signal. Portion distortion. Portion distortion, supersized portion at restaurant have distorted what Americans consider a normal portion size. And that affect how much we eat at home as well, said Dr. Elizabeth Jean Nabel, Director of the National Heart, Lung, and Blood Institute. One way to keep calories in check is to keep food portion no larger than the size of your purse. Lean body mass. Lean body mass is mass of non-fat body part. Mass of non-fat body part. Body weight. Body weight is sum of weight of fat and lean body mass. Body weight, sum of weight of fat and lean body mass. Body mass index, BMI. Body mass index, BMI, the current standard for assessing healthfulness of body weight. Body mass index, BMI, the current standard for assess the healthfulness of body weight. Underweight. Underweight, being naturally lean and thin, is just fine. Being thin due to starvation, undernourished, or eating disorder is not healthy. Underweight is not healthy. Underweight, being naturally lean and thin, is just fine. Being thin due to starvation, undernourishment, or eating disorder is not healthy. Overweight. Overweight is a person may be overweight but exercise weekly and eats healthy. Overweight, a person may be overweight but exercise weekly and eat healthy. Muscle versus fat. Muscle versus fat. What really matters is body composition. Lack of muscle mass can result in high BMI. Lack of muscle mass can result in high BMI. Body composition. Body composition, the relative proportion of fat and lean tissue that make up the body. Body composition, the relative proportion of fat and lean tissue that make up the body. Excess weight is only part of the story. Excess weight is only part of the story. Excess body fat is what really put you at a risk. Excess body fat is what really put you at the risk. Young healthy female, 21 minus 32% of total weight. Young healthy female, 21 minus 32% of total weight. Young healthy male. Young healthy male, 8 minus 19% of total weight. Young healthy male, 8 minus 19% of total weight. With age. With age, lean body mass decrease. With age, body fat increase. How do you test body fat percentage? How do you test body fat in percentage? Number 1, skin fold measure. Number 2, underwater weighing. Number 3, air displacement. Number 4, bioelectric impedance. Next is dual energy X-ray absorptiometry. Location of body fat. Where the fat is located is also very important in determining health risks. Subcutaneous fat. Subcutaneous fat located under the skin. Fat around the thigh and lower body is subcutaneous. Fat around the thigh and lower body is subcutaneous. Visceral fat. Visceral fat located around the organ in the abdominal area. Visceral fat located around the organ in abdominal area, thus increase health risks. Maintain weight. Maintain weight is calorie consumed minus equals calorie expended. Maintain weight, calories consumed equals calories expended. Weight gain. Weight gain is calorie consumed and calorie expended. Maintain weight. The energy we expend in physical activity include both planned exercise and daily activities, walking, typing yard, work, and etc. Non-exercise activity. The energy we expend in physical activity include both planned exercise and daily activities, walking, typing yard and work, etc. Non-exercise activity. Thermogenesis need. The amount of energy expended depends on the size of the person, how strenuous the activity is, and number 3, the length of time activity is performed. Thermic effect of food, TEF. Thermic effect of food, TEF. The energy used to digest food and absorb, metabolize, and store nutrients. The energy used to digest food and absorb, metabolize, and store nutrients, TEF, is estimated at about 10% of total energy expenditure. TEF is estimated at about 10% of total energy expenditure. Weight loss decision. Weight loss decision. Number 1, measure height and weight and calculate BMI to see it is in the healthy range. Number 2, assess for obesity related condition that increase healthy risk. Number 3, make weight loss recommendation for obese individual and overweight individual with one or more obesity-related condition. Healthy BMI is 18.5 but 25. Overweight is BMI 25 but 30. Obese BMI 30. Losing weight. Losing weight is eat less, exercise more, or both. Change behavior that lead to weight gain. Number 1, to lose pound of fat, decrease intake or increase expenditure by about 3,500 calories. Number 2, to lose pound in a week, keep energy balance by about 500 calories a day. To lose pound in a week, keep energy balance by 500 calories a day. Losing weight at rate of 1/2 minus 2 pounds week help ensure mostly fat loss and not lean tissue. For most people, our loss of 10% of body weight will significantly reduce disease risk. Gaining healthy weight. There are people who desire to gain weight and have difficult time gaining weight. Most of the time, this is genetic and hormone regulated, and they may not able to gain weight. Obtain a medical evaluation. If they are not getting enough food, gradually increase energy density while maintaining nutrients density. Gradually increase energy density while maintaining nutrient density. Nuts, peanut butter, milkshake 100%, fruit juice, and whole milk. Eat more meals, increase portion size, and increase number of snacks. Do not skip meals. Strength training. Factors contributing to eating disorder. Genetics is inherited personality traits, genes that affect hungers and body weight. Psychological is low self-esteem, need to self-control, and unhealthy body image. Socio-cultural. Teen body deal influence from media, family, and friends, and abundant food supply. Anorexia athletica. This is affected of athletes. Anorexia athletica engage in compulsive exercise to lose weight or maintain a very low body weight, can lead to more serious eating disorder and serious health problems including kidney failure, heart attack, and death. Avoid and restrictive food intake disorder. Avoid restrictive food intake disorder. Affected this is infant and children and adult. Avoid of restricted food intake disorder is similar to anorexia nervosa in that the individual avoid eating and experience weight loss and other physical symptoms of anorexia. However, there is no distorted body image for fear and weight gain. No distorted body image to fear weight gain. Diabulimia, insulin misuse. Who is affected? People taking insulin to control diabetes. Diabulimia, a disorder in which insulin doses are manipulated to control weight. Without insulin, glucose cannot enter cell to provide fuel. Blood levels rise and weight drops. However, over the long term, elevated blood sugar can lead to blindness, kidney disease, heart disease, nerves damage, and amputation. Female athlete triad. Who is affected? Female athletes in weight dependent on sport. Female athlete triad, a syndrome involving energy restriction along with high levels of exercise that cause low estrogen level. Low estrogen level lead to amenorrhea and interfere with calcium balance, eventually causing reduction in bone mass and increased risk of bone fracture. It is a component of relative energy deficiency in sport. Rumination disorder. Who is affected of rumination disorder? Infant, children, adolescent, and adult. Rumination disorder, eating, swallowing, and then regurgitating food back into the mouth where is chew and ejected re-swallow. It causes bad breath, indigestion, chapped lips, damage to the teeth and other tissue in the mouth, aspiration of food leading of pneumonia, weight loss, and failure to grow the children, electrolyte balance, and dehydration. Selective eating disorder. Who is affected? Affected is children. Eating only a few foods, mostly those high in carbohydrate. If the disorder continues for long period, it increases the risk of malnutrition. Energy intake. Energy calorie you eat and drink. Energy comes from energy yielding nutrition and alcohol. Nutrient composition tables of database and food label can be used to determine caloric intake. Energy expenditure. The total amount of energy used by the body. Number 1, normal body function. Number 3, physical activity. And next is processing food. 60 minus 75% of total energy is used on basal metabolism, the function that keep you alive. Basal metabolic rate, BMR. Basal metabolic rate, BMR, rate of energy use at rest and fasting. Basal metabolic rate, BMR, rate of energy use, rest, and fasting. The end. Bye-bye.